This is a female hairline lowering that I just completed the recipient sites on. This is a woman that was born with a higher hairline, but she also has recession. As you can see, the hair is thinning, especially in this frontal temporal region, which is almost like a male pattern loss, if you will. And so what's important are a few things. One is in terms of the design. You can see this hairline is very different from a male hairline in the sense that there's this central cowlick. The little insets going across here are not as abrupt as you would see on a male. You can see that across this area here, the angles go to the side and then sweep down and move back down toward the temple. There's a large temple component. On the right side, the temple is actually far deeper than on the left side. So we'll compare it on this side over here, and you can see actually this side, it's a rather shallow loss. Okay, and then this area right here, the angles almost sweep backwards. And so this angle over here sweeps across, down, and forward. And so these different angle changes are really what make this a very unique pattern and what makes it fun. I mean, to design female hairlines is actually a lot of fun because it's so unique in every single patient. One thing I want to stress in this video is the difference between a surgical female hairline lowering versus a hair transplant. A surgical female hairline lowering is making the incision all the way across here and then advancing the scalp forward. We don't do that as often, and there's several reasons why. Let's use this patient as a good example. So first of all, a surgical female hairline lowering advancement, you miss all of this area right here. Okay, this whole area, you cannot actually advance it. That still needs to be transplanted. And so the same thing over here, it's a little less, but it's still quite extensive. You miss all of this area. You can't transplant that, you can't advance that surgically. The other thing is think about this. If you look at this degree of loss over here, you see that it's etching more, greater and greater loss, greater and greater loss, greater and greater loss. So if you try to make an incision across here, you've got to sacrifice all these thin hairs, which is quite a few hairs that need to be thrown away because they're not, it's a gradual loss. So I instead have the more creative ability using a transplant to come in here and feather into the areas of loss rather than just making that large incision across here. One thing you'll see is that the shape of this hairline is very unique in the sense that where she parts across here and going across this way, there's an illusion of a much longer line on the right side. So what I did was after I designed the hairline, I went to the front of the patient and looked at how it looked. And to me, on the right side, it looked a little too straight because it's a longer limb. So what I did was I created what's called a lateral mound, which is a very common feature in a female hairline, which is just a little lateral extension. These are just one hair grafts that come out here and visually break it and create a more feminine shape. Men rarely have this lateral mound, but women have this. And so these little things are really a labor of love. They really make this fun, and I actually enjoy narrating this because, you know, I've had some surgeons come and watch me, and during their time here, I emphasize to them how creative hair restoration can be. So as I discuss this, I just sort of pan back and forth very slowly so no one gets sick here, hopefully, and show you the differences of both sides. And they're very different. The left is very, very different in design compared to the right side. So this is something that she was doing for both because she had lost the frame to her face. So if you think about this is the vertical forehead. It's hard to see on a two-dimensional image. This is the horizontal plane. So she was so far back, she lost the visual frame to her face. And actually, about a month ago, I actually filled this temple in with a little bit of filler. And so that this whole area is now enhanced in a topographic fashion, in other words, in a contour fashion, that I think will really enhance the way that the hairs look as well. So this is just an update to some videos that I've shot about female hairline lowering and female hairline design.